Right. Okay, okay. Okay, now today's lecture is on the blood supply of the nervous system. Okay. Assalamualaikum wabarakatuh and very good morning. Okay, so this should be straightforward enough since you have learned CVS. So let's go through one by one. Okay, so this is to describe the blood supply, venous drainage, and the likely blockage of these vessels. Okay, for the active supply of the brain, you have vertebral artery and internal carotid artery. Okay, let's go one by one in detail. Okay, so internal carotid artery first. So you know that this is your arch of aorta. Remember your CVS lecture, ingat So here is your brachiocephalic trunk. Here is your left common carotid artery and left subclavian artery. This is the three branches of the arch of aorta. Okay. Okay, so brachiocephalic trunk on the right, then it divides into right subclavian and right common carotid artery. And then it then divides into right external carotid and right internal carotid. Remember that? Ingat kan? So if you look at right and left, here is your right, here is your left. This is arch of aorta, brachiocephalic trunk, right common carotid, and right internal carotid. So for the left side, it straight away go to the left common carotid and become internal carotid artery. Okay, that is the internal carotid artery. Okay, so then when it goes up, it goes up. This is your common carotid. The green one is the internal carotid artery. Okay, it enters the middle cranial fossa through the carotid canal. Okay, so here is your carotid canal here. Okay, this is your inferior view. So you can see this from looking from the bottom or from the inferior side view of the cranium. So here is your carotid canal. Okay, and here is when you take off the cranium. This is from the superior view. Very pendek je sebabnya. Carotid canal is very pendek. So here is your carotid canal. Kat sini. So whatever that you see here is here lah. Okay, this is your carotid canal. Carotid canal senang je internal carotid artery Okay. So then it passes through the cavernous sinus. Okay. So once dia dah masuk, it goes in. It goes in here. It straight away passes through the cavernous sinus. So this is quite interesting. Okay. So cavernous sinus is actually a vein. Okay. This is cavernous sinus. So all the blue one is all venous system. Venous system. They have venous sinuses and then vein. Okay. So the artery actually is bathed, dimandikan. It is bathed inside the cavernous sinus. So this is the cavernous sinus. You can see the vein and it connected, and then this is the artery inside. Internal carotid artery passes through cavernous sinus. This is a coronal section. This is a very important section. This one where you will learn in your cranial nerve lecture as well. Okay, here the yang macam bawang ni adalah pituitary gland. So you can see if you cut here, okay, you can see here. Okay, so here is the blue one, all are cavernous sinus, and the red one here is the internal carotid artery. Here, so it is inside the cavernous sinus, and you have a few nerve on laterally. Tak apalah, nanti awak akan belajar nanti later on. Okay. So again, here it is to show you lah. Ni cavernous sinus dengan this is internal carotid artery. A few pictures that you can see here as well. Okay, this is very obvious. Okay. Then what happened? It passes lateral to the optic chiasm. Okay, actually you've seen that before as well. So here is the optic chiasm. Remember, I was telling you it's like X. Optic nerve is here. Sorry. Optic nerve ke depan. So here your eyes is here, right? Eyes is here. So they can cross macam tu. Okay, and your the carotid artery is lateral to the optic chiasm. Okay. Again, this one is internal carotid artery, and this is optic chiasm. Macam H ke atau X, whichever lah. This is lateral to the optic chiasm. This one is another big picture. So internal carotid artery is lateral to optic chiasm. Okay. So, terminal branches of internal carotid arteries are anterior cerebral artery and middle cerebral artery. Anterior cerebral and middle cerebral. So, tadi kat sini tadi adalah dia punya optic chiasm kat sini. If you remember, here is where the optic chiasm is, somewhere here. Internal carotid artery is lateral to it, and it has two terminal. One is middle cerebral artery. Number two is anterior cerebral artery. So ni yang dua ni, middle cerebral, anterior cerebral. Can you follow me? Boleh ingat eh? Can you see? Can you see? Yes or no? Middle cerebral,
Yes, doctor.
Yes.
anterior cerebral. Good, thank you. Okay, just in case if you. Okay. Other branches. Okay, now the red one macam lebih important lah. But if you can memorize all, is better lah. Okay. So now you know the terminal branches are middle cerebral and anterior cerebral artery. Okay. Dua je. Penting. Hypophyseal ni maksudnya dia supply the pituitary gland. Hypophyseal is about pituitary gland. Okay. Superior and inferior. Okay. Ophthalmic is going towards the eye. Okay. Choroidal mean choroid plexus lah. Okay. Tak apa. Yang penting lah, posterior communicating. Here is another branches of internal carotid artery. Don't worry about it. We will go through one by one. You will be you find it easier afterwards. Don't worry. So meningeal is for meninges. Vidian, and this one is outly ignore je. Okay. So this is another picture. Anterior cerebral artery. This is your nampak tak ni? External carotid, internal carotid. Okay. Ophthalmic artery. Middle cerebral artery. Anterior cerebral artery. Posterior communicating artery. So this is another way of seeing it. So what you should remember, terminal ada dua, and then you have meningeal, ophthalmic, posterior communicating. Artery to the pituitary gland pun boleh tambah. So this is, I've got you the mnemonic, a Vips comma. Okay, at least if you can get a few that you can remember. Anterior cerebral artery. Okay, but it's important, middle cerebral. Internal carotid artery branches. If you can remember, middle cerebral, anterior cerebral. Artery to the meninges. Okay, artery to the eye, ophthalmic. Okay, and then posterior communicating artery. Okay. Now let's do. Baru 9 page. Right common carotid artery arises directly from arch of aorta. True or false?
False.
Good.
False.
Internal carotid artery passes through the carotid canal into middle cranial fossa. True. Good. Internal carotid artery lies lateral to cavernous sinus.
False.
False.
Very good. Optic chiasm is lateral to internal carotid artery.
False.
False.
Very good. Internal carotid, yes, correct. Internal carotid artery gives off posterior cerebral artery.
True.
True.
False.
False. Very good, very good. Middle cerebral artery is one of internal carotid artery's terminal branches.
True.
Very good. Internal carotid artery supply the meninges. True. Very good. Now, that's internal carotid artery. Okay kan? Boleh follow Okay.
Yeah.
Vertebral artery pula. Okay, just now sama je. So this one is coming from the subclavian artery. So cephalic, subclavian, right vertebral artery, left vertebral artery is coming from subclavian. So subclavian artery on the left, vertebral. Subclavian artery on the right, after coming from brachiocephalic trunk, vertebral artery. Okay, easy lah. Okay, it ascends through the transverse area foramina of the cervical vertebrae. So if you remember your neck, your vertebral lecture last year, so you have in your cervical vertebra kan dekat yang transverse foramen, ingat tak dia ada foramen, transverse process dia ada foramen, remember? Ingat tak? Tak ingat?
Yes.
Ingat kan? Okay. So that foramina, the transversarium foramen of the cervical vertebra, is for the vertebral artery to pass through. except C7. Kau tengok sini Can you see? C7 dia tak lalu. Dia lalu kat C6, C5, C4, C3, C2, C1 dia naik atas. So vertebral artery passes through the transverse area, foramina, except C7. Always remember that. And then it enters through the foramen, enters the cranium through the foramen magnum. Okay. Again, this one here. So see subclavian artery, branch, vertebral artery, it goes through the foramina, the transverse foramina of C6, 5, 4, 3, 2, 1, and then enter the cranial cavity through the foramen magnum. Boleh? Good. Okay. And then it converge to form basilar artery. So you can imagine ni dua kan? This is vertebral artery lah. Okay, coming from the neck. Then it converge, become one artery called the basilar artery. This one is also another picture. Converge to form basilar artery. Okay. Branches, spinal artery. Okay. Awak tengok kat sini, dia ada dua. Anterior spinal artery yang ni. This one. And then they converge into satu. Okay. Anterior spinal artery coming from the vertebral artery, right and left, become anterior spinal artery, which means they supply the anterior part of the spinal cord. And then you have the posterior spinal artery here. And ini kekal dua. It stays as two. So you have two posterior spinal artery and one anterior spinal artery. Okay, sama kan? Ini tidak tunjuk posterior spinal artery. Another branch is posterior inferior cerebellar artery, PICA. Posterior inferior cerebellar artery, PICA yang ni. Obviously this one we supply the cerebellum lah. Okay, cerebellum. Okay, so that's the branches of the vertebral artery that you should remember. Okay, so you can see there's two posterior spinal artery kat belakang and then one anterior spinal artery dekat depan. Okay, see, ni kat belakang lah ni. Okay, this is a how do you remember? Macam ni, one of the way to remember it, buka tangan. Okay, your first digit and third digit is your vertebral artery. Okay, this is to remember your PICA and your anterior spinal lah. Anterior spinal ada satu je kat tengah, and then PICA dua. Boleh tambah satu lagi lah kot. Posterior spinal artery juga kan, tapi dekat belakang dua juga. Okay, hopefully that helps to remember. Okay, so basilar artery formed by the union of two vertebral arteries ascends in the groove on the anterior surface of pons. So pons, there's a groove or sulcus where the basilar artery passes through. Okay. Okay. And then the upper border of the pons is divided to posterior. Now we have posterior cerebral artery. Ini besar ni. So vertebral artery unite. Then dia ada divide dua, which is your posterior cerebral artery. Branches, number one, pontine artery. Senang je ni, pontine artery. Yang ni. Yang supply the pons. Pontine supply the pons. Labyrinthine artery, this is to internal ear. Then you have AICA, anterior inferior cerebellar artery. Tadi PICA, posterior inferior. Tapi kita senang je kita nak hafal dia. Don't worry, I will teach you afterwards. And then superior cerebellar artery. And then you have posterior cerebral artery. Posterior cerebral is a branch of basilar artery. Just now, anterior cerebral, middle cerebral is a branch of internal carotid artery. Posterior cerebral is a branch of basilar artery. Okay. Other branches, superior cerebellar. Okay, awak tengok sini superior cerebellar kan? Superior, inferior. Okay. So dia ada superior, mula-mula awak divide dulu. Superior and inferior cerebellar artery. Tapi inferior ada dua, anterior and posterior. So that's why you have PICA and AICA. Okay. Okay. So this is the circle of Willis. Circle of Willis. This is circle of Willis. It lies in the interpendicular fossa So there's a like macam groove rasanya macam pun macam it's like a how do you say macam lubang lah kot how do you say kat sini it's called the interpendicular fossa between the peduncles fossa here of the base of the brain. Okay. Formed by anastomosis between two internal carotid and two vertebral arteries. So that is the source of this circumvallus. So you have internal carotid here and you have a vertebral artery here. Okay. So vertebral artery kan dia form pacilla and then dia ada posterior cerebral kan. And then internal carotid kita ada middle cerebral dengan anterior cerebral artery. And then one of the branches of the internal carotid is also posterior communicating artery. So this ring is constituted by anterior. Okay, satu lagi yang awak kena tahu. Anterior cerebral artery is the terminal branch of internal carotid, right? This one, you see? This one here. And it also joined in the middle by the anterior communicating artery, which connects between the two anterior cerebral artery. So the whole circle is now formed by anterior communicating, anterior cerebral, dua on both sides, okay, internal carotid artery here, okay, posterior communicating here, okay, and then posterior cerebral and also basilar. So you have 1, 2, 3, 4, 5, 6 arteries that forms the circle of Willis. Okay. So this basically the circle of Willis, it provides anastomosis between anterior. This is the anterior circulation. Sebab alamak saya tak ambil gambar yang macam tu tepi because this is you're looking from the inferior view but if you're looking from the lateral view you know that this one is anterior and this one is posterior, but you can imagine lah you're looking, this is the anterior part of your brain. Sekejap saya cuba cari tengok. Saya patutnya buat deng 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 deng, so that you can understand why is it called anterior and why is it called posterior view. Or maybe we have that picture already. Look, let's see.
The slide before maybe right?
Ada slide before. Sekejap. 2 second there. Yang ni kot. So you can imagine somewhere here lah. Tak cantik. Soalnya dia ada. I think I've seen this before, but let me find it later on, and I will share you in the slide later on. So and then I can just paste it. Okay, what dia akan nampak lah. Kenapa? Macam mana? Macam ni you can see yes, this one. So you can see here is your anterior, because this is anterior, right? This is posterior. So that this is what it's called anterior. Apa term dia? Called anterior circulations and posterior circulations. Okay. So let's say for example, okay, imagine that if there is interruption dekat internal carotid artery, the vertebral artery that comes off here, pacilla, they still boleh cover the affected brain regions. In case kalau ada blockage lah ataupun ada anything that disrupt the blood flow, because we know that once arterial supply is affected, then you have a very detrimental effect. Okay, so however, aneurysm is quite common in not like common, more common lah in the circle of Willis area. Aneurysm, you should know already by now, balloon-like swelling of the artery, so like this, okay, and has a risk of rupture, so it can rupture. So when it's rupture, it can cause hemorrhage, okay, which is not good. And then of course then it will affect your blood supply to your brain, and that's aneurysm. Okay, so true or false, vertebral artery arise from common carotid artery? True or false? Hello?
True.
Vertebral artery, false. It's coming from the subclavian artery. Okay. Again, tengok balik. See? aorta, subclavian, vertebral artery. Okay. Common carotid is coming from the internal carotid artery. So don't get confused between the two arteries. It's okay. Vertebral artery passes through the foramen transversarum of atlas.
True.
True. What is
True.
atlas? What is
The
atlas?
vertebra.
C1. Very
C1.
good. C1. Very good. Vertebral unites to form basilar artery.
True.
True.
Very good. One of the branches of vertebral artery is anterior inferior cerebellar artery.
True.
True.
Posterior sebenarnya. Anterior adalah basilar. Okay, if you look at again, tak apa, it's okay, no worry. Okay, if you look, I said, this is, if you look at here again, it is superior cerebellar. You have inferior cerebellar. Look at, and ignore the first ayat dulu. And inferior cerebellar. Okay, these three arteries are for your cerebellum. Okay, so cerebellum has superior artery and two inferior artery. The inferior artery has anterior and posterior. Okay, the posterior one is coming from the vertebral artery. The anterior one is coming from the the posterior one coming from the vertebral. The anterior one coming from the basilar, and the superior is coming from the basilar artery. Okay. Okay. Basilar artery supplies the cerebellum.
True.
True. Very good. Basilar artery runs posterior to the pons.
False.
Very good. Posterior communicating artery is a branch of basilar artery.
True.
False.
False. It's a branch of
Internal.
carotid artery. Very
Good.
good. Okay. Tak apa. Now let's try. What is A?
Vertebral artery.
Vertebral artery.
B?
Basilar
Basilar
artery.
artery.
Very good. How about C? C?
Internal
Internal
carotid
carotid
artery.
Very
artery.
good. D?
Anterior
Anterior
cerebellar artery.
Anterior cerebral artery. E?
Middle
Medial
cerebral
cerebral
artery.
artery. F? F?
Posterior
Posterior
communicating
communicating artery.
Communicating artery. Very good. G?
Posterior
Posterior cerebral artery. Very good. H?
anterior communicating artery.
Very good. Well done. First time kan belajar kan? Betul tak? So now you remember. Very good. Excellent. Very good. Excellent. That's good. Impressive. Okay, now anterior cerebral artery. Let's go one by one. So you know that it's a branch of internal carotid artery. Okay. So kat atas ni kan. Mula dia runs forward dulu ke depan and medially in the fissure of the longitudinal fissure yang bahagi dua di antara left and right hemisphere. Okay. And then it curves back over the corpus callosum. Look, nampak dia curve. Can you see? It curving depan atas. So it anastomose then with the posterior cerebral artery. So this is posterior, dia anastomose kat sini. Okay. Again, this is the posterior cerebral, dia anastomose dengan anterior cerebral. So anterior cerebral di depan, then dia curve over the corpus callosum. Okay. Now, in the cerebral longitudinal fissure, the two cerebral artery are joined by anterior communicating artery. So yang ni lah anterior communicating artery. So in the fissure, they joined by the communicating artery. Okay. So what does it do? It supply the lateral. So the medial surface of the. So ni kan. If you look at the orange one, look at the orange one. So this is your coronal section. Nampak tak dekat medial side, tengah-tengah. This is when you cut the brain into two. You can see it is in the middle. Okay. But the superior part laterally, dia akan juga supply sikit. Nampak tak atas ni? 1 inch wide on the adjoining lateral surfaces. Okay. So this is the medial side. Of course, dia akan lari tengah-tengah, dan dia then they curve back. So dia run here, then they curve kat sini, remember, and then dia akan anastomose dengan posterior cerebral artery, and then they supply dekat semua medial side of this anterior cerebral artery. So again, look, anterocerebral. So if you compare to your homunculus, ingat tak homunculus? Belajar kan? From Dr. Nurul. Okay, your homunculus,
Belajar.
belajar kan? So you can see, kalau look at medial side, it is your leg. So kalau anterior cerebral artery ini ada, there's a ischemia or there's any blockage, it will affect the leg. So you will have weakness of your leg if there is a blockage of the anterior cerebral artery. So it supplies the lower limb and also the perineum, your genitals area, both frontal and parietal, meaning your motor and your sensory will be affected, as well as paracentral lobule. Okay. And look at, so, and also, masa dia, kan ni kat sini kan? How to say, sekejap. This is your corpus callosum, right? This is your corpus callosum. I'm going to paste a picture so that you can understand what I'm talking about. Inilah, senang sikit. Okay. Just put it here so that you guys can follow what I'm talking about. So, can you see the ini kan the curve? So now it's above the corpus callosum. So here is above corpus callosum. Can you follow? Curve above corpus callosum. Here is also above corpus callosum. So then dia akan supply the medial side of your brain and then a bit of the lateral side ke atas. It also send off branches to the central branches to the lentiform and caudate nucleus, which you have studied yesterday from Dr. Choi. Correct? Kan? Betul kan?
Betul.
Betul So that's why anterocerebral artery ada sikit part of the centiform and part of the caudate as well as the internal capsule. Here is your internal capsule. So from this cortex lalu sini kan, lalu turun bawah. So this is your internal capsule here. So it supply lentiform as well as internal capsule. Okay, since it is supplying the medial surface of the brain, so kalau ada sebarang, if there is any blockage, so you can, this is your CT brain, okay, looking from the inferiorly. Yang black area ni adalah infarct area. Siapa yang minat tak radiology ataupun neuroscience, neurology nak become neurosurgeon ada. So here is an hemorrhage, subarachnoid hemorrhage. Kalau blood, dia akan nampak putih. It's white on the CT brain. So it is likely to be a rupture due to the anterior cerebral artery. Got it? Boleh faham Okay, now let's go through one by one. Anterior cerebral artery is a branch of internal carotid artery. True or false?
True.
Very good. It runs in the lateral surface of the cerebral hemisphere.
False.
False.
False. Very good. It supplies the Broca's area.
False.
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 Very good. It curves back over the corpus callosum.
True.
True.
Very good. Its occlusion causes impairment of vision.
False.
False.
Very good. Excellent. It sends branches to the internal capsule.
True.
Very good. True. It anastomoses with the posterior cerebral artery.
True.
Very good. Its rupture results in ipsilateral weakness of the lower limb.
False.
Oh, it is a contralateral.
Contralateral.
Okay, the other side. It supplies the thalamus.
True.
False. Tak ada. Okay, so ada tadi saya sebut tadi, lentiform, caudate nucleus, internal capsule. Okay, medial cerebral artery pula. Okay, already halfway. So medial cerebral artery is the largest branch of internal carotid artery. Paling besar. Okay, it runs laterally. So this one is laterally. Just now is medially. It runs laterally in the lateral fissure. You see the lateral fissure right here. Okay. It gives off branches within the fissure. Banyak branches dia. Okay. Terminates into the superior and inferior branches. So it is a superior branches, inferior branches, and supply the lateral surface of the cerebral hemisphere. Cerebral hemisphere. Okay. Nanti saya hantar balik yang baru Okay. Now, central branches enter the anterior perforated substance to supply the lentiform, caudate nucleus, and as well as internal capsule. So yang tadi, remember I was showing to you the same picture. anterior cerebral artery. This is your middle cerebral artery. Ini coronal section tau. So dia pergi, can you see? It's going to the lateral. Going to the lateral, and then the other branch superiorly. And also the other branches supplying the lentiform caudate nucleus as well as the internal capsule. L lentiform, C caudate nucleus. Here is the internal capsule. Okay. So, okay. I think you've learned a little bit yesterday as well, isn't it? That is supplied by the here, we call as the lenticostriate artery. Saya kan semalam kan belajar sikit-sikit, I think. It's a branch of the middle cerebral artery. It supply the lentiform caudate nuclei as well as internal capsule. So again, internal carotid, middle cerebral, and then the other lenticulostriate arteries. So you can see this is your lentiform. Kat sini ada internal capsule. Okay. Okay. Now. And also this is a caudate nucleus. Okay. Boleh follow tak? Hopefully you can still follow me. Okay. If you look at here, again tadi kita tengok orange for intercerebral. Now we are looking at the green. Here is your middle cerebral. Middle cerebral, green. Lateral side. Look, lateral side. Okay. Except that supply narrow strip supplied by ACA. Inferior occipital pole. Okay. And inferior lateral surface. Kat sini. Okay. And also tengok kat sini. So if you look at lateral side of the brain, kalau homunculus kan banyak kan, tangan, muka, lidah. These are covered. So if there is a blockage of middle cerebral artery, it will affect your arm, your face. That's why you can see the grouping of the face, weakness of the arm, things. Okay. Okay, and then motor, except for paracentral lobule. Of course, the speech area. Speech area dekat mana? Frontal kan? Frontal lobe, remember? Sensory, sensory, vernicase. Okay, this is your understanding and how you interpret what you perceive when people talk to you, and also auditory. Okay. So again, if you look at the green part, here is your supply orbital area except the leg area. So here is your homunculus. I think lateral. So you can imagine lah the effect kalau middle cerebral artery is affected. This is a picture of, look, the lateral side. This is your, there are a few days ago infarction that happened of the middle cerebral artery. You can see it's affecting badly lah. A lot of the nerve cells are affected. This is your subarachnoid hemorrhage due to rupture of the middle cerebral artery. Whitish. You guys okay?
Okay, doctor.
Okay, doctor.
Very good. Okay.
Doctor.
Middle cerebral artery is a terminal branch of internal carotid artery.
True.
True.
Very good. It runs in the lateral fissure.
True.
True.
Very good.
True.
Occlusion results in speaking difficulty.
True.
True.
Very good. Blockage is associated with contralateral muscle weakness.
True.
False.
Very
True.
good. Supplies the putamen.
False.
Okay, what is lentiform?
Putamen and logo.
So does it supply the putamen? So true lah. Okay. Inferior branches supply the visual cortex.
True.
False. Okay, awak tengok tadi. Dia tak supply visual cortex. Visual cortex is here. Can somebody who's talking apa yang buka tu ni sikit. Punya, okay, sorry. So the visual cortex is here. It does not supply the visual cortex. Okay. Because visual cortex is supplied by posterior cerebral artery. We talk after this. Okay. Which is posterior cerebral artery. Okay. So origin basilar artery, you know that already. Okay. It curves laterally around the midbrain. So in the posterior cerebral artery curves laterally. Curve, okay. And joined by posterior communicating branch of the internal carotid artery. So this is the posterior communicating branch. Okay, maksud dia curve tu. And supplying the inferior lateral and the middle surface of the temporal and occipital lobe. So let's have a look. Ataupun is another picture here. Posterior cerebral artery, you curve. And posterior communicating artery here. Okay, again, this one is again curve ke belakang. Okay. And then, oh, this another picture cantik gambar dia. Okay, so posterior cerebral artery. Yang ni dah cut. Oh, this one is not for that. So this is for the cerebellum. Saya salah gambar ni. Tapi nanti potong boleh lah. This posterior communicating artery. So joined by. Okay. Okay. The central branches supply part of the thalamus. Pineal gland, medial. So ini penting lah thalamus. Okay. And then the choroid branch supply the choroid plexus in the ventricles. So here look, anterior cerebral artery. This is your caudate. This is caudate nucleus. This is putamen. This is your thalamus. Okay. You can see the middle cerebral artery supply the caudate as well as putamen. Anterior cerebral, caudate, putamen, caudate. Posterior cerebral, thalamus. Nampak tak? Can you see? So you can use this picture lah to understand. Okay. This is to show you the area. So anterior cerebral artery, medial cerebral besar, and posterior cerebral. Okay. This one you can see the posterior cerebral curves to the back. Okay, curve to the back. Okay. This is more down lah. Okay, this one is don't compare here. This one is more inferior, so that's why you can see all these are supplied by posterior cerebral artery because this is supplying the inferior part. Okay. So if you look at this picture again, the blue part is your posterior cerebral. Part of the lateral side tapi kat belakang and also inferior kat sini. Inferolateral. Inferolateral of the brain is supplied by posterior cerebral artery. This is a picture of posterior cerebral artery bila dia rupture. Okay, this is acute infarct, bukannya bleeding. So kalau acute baru je happens the infarct, so you can see a bit whitish, and then eventually dia akan jadi black like this. This is your a bit chronic. Okay, and then okay, straight away to cerebellum first. As I said, cerebellum has 3 arteries coming from superior cerebella from basilar, anterior inferior cerebella, posterior inferior vertebral. And look at here. Okay. This is your cerebellum, remember? I know you like the lecture. And then you have the superior cerebellar artery. Okay. Anterior inferior, posterior inferior. So sini dia. This is anterior, right? This is posterior. Okay. Yang atas superior cerebellar atas, and then you have 2 inferior. One is anterior and one is posterior. Anterior one coming from basilar, posterior one coming from vertebral. Got it? Faham tak? I hope you understand that. Okay. Again, this is another picture just to show you the ni superior cerebellar yang biru ni. And you have anterior cerebellar and near the follicular. This is your follicular nodular nodes and anteriorly lah, and then you have the posteriorly here. But you do have to remember lah the areas. Okay. Now this is just a table, but you can go through afterwards. Okay. So you can see, for example, area of plantiform is supplied by medial and anterior cerebral arteries. Thalamus is supplied by mostly posterior cerebral artery. Midbrain and pons, of course, dia ada kaitan dengan basilar artery. Okay, basilar artery. This is all a basilar artery, right? Origin, this one is also basilar artery, kan? Betul tak? Posterior cerebral. This is easy, eh? Don't get too bugged with it. Kalau tengok sebelum tak ada benda pun sebenarnya. Okay. Pons all a basilar artery. Okay, pontine artery, superior cerebellar, although it's supplying the cerebellum, it also supplying the pons along the way. Right? ICA, okay, is a branch of the basilar artery. It's also coming from the basilar artery. It's also supplying the pons. Okay. If you look at the medulla oblongata, okay, which is inferior to the pons, you have vertebral artery, which makes sense. Anterior spinal, posterior spinal is all making sense because it's all baru keluar daripada vertebral artery. Okay. Okay. Also part of the basilar artery as well, also supplying the medulla oblongata. So you can go through this and see. It should be easy enough sebenarnya. Okay. I did this to help you, so you probably go through the table afterwards. Okay. Basilar artery gives off posterior cerebral artery. True or false?
True.
True.
Very good. Posterior communicating artery is a branch of posterior cerebral artery.
False.
Very good. A branch of posterior cerebral artery supplies secondary visual area.
True.
Very good. Anterior inferior cerebral artery is a branch of basilar artery.
True.
Very good.
True.
Posterior inferior cerebral artery supplying the medulla oblongata.
True.
Very good. Thalamus is supplied by posterior cerebral artery.
True.
True.
Very good. Excellent. Okay, now we're going to the veins. Okay. Okay, veins of the brain. So far okay ke? Are you guys okay? Boleh follow?
Okay, Doktor.
Very good. Very good. Veins of the brain. Okay, so one thing, there has no muscular tissue at all. Okay, no valve emerge from the brain. So the artery vein there, they lie in the subarachnoid space. Okay, and then pierce the arachnoid matter, pierce the meningeal matter, and then they drain to the venous sinuses. Okay, venous sinus, vein, the sinus ni macam besar. Vein ni kecil-kecil ni. Actually, they are all veins. Okay, but just don't get to jangan confused dengan term venous sinus and vein. So here is the venous sinus. We already learned superior sagittal sinus before. So the vein is coming, surrounded space, pierce through, masuk sini. Okay. Okay, so dia ada external and internal cerebral vein. Vein dulu So superficial or deep vein. Okay. Awak boleh pilih yang merah-merah tu saya letak tu macam sebagai priority. Lain tu macam if you can remember it's very good lah. More of a postgraduate level. You have superior cerebral, superficial middle cerebral, and deep middle cerebral. So superior cerebral, middle cerebral ada dua, which is superficial and deep. Okay. And then the superior cerebral akan drain into superior sagittal sinus. Superficial middle cerebral akan drain into the cavernous sinus. So if you look at here, superior cerebral vein. Yang ni yang ni. So dia akan drain into the superior sagittal sinus. This is a superior sagittal sinus and ini. And here your superior cerebral vein. And then here is your superficial middle cerebral vein. And then dia akan yang ni. Dia akan masuk dalam, dia akan supply, dia akan this is your sagittal cavernous sinus. Ni yang macam sel. Okay. So superficial middle cerebral vein akan drain into the cavernous sinus. Susah sikit tapi saya akan cuba mudahkan ni, mana yang mudah. An internal cerebral vein, you have thalamus, striate, and choroidal. Of course, they are all the basal ganglia, thalamus, blah blah blah. And then eventually, the internal cerebral vein akan masuk straight sinus. So you remember this. Saya taklah merah supaya awak boleh follow. Tak payah hafal semua, tapi hafal benda yang penting sahaja. Yang pentingnya straight sinus. Sorry. Okay. So you can see the vein, internal cerebral vein, great cerebral vein, so dia akan pergi ke straight sinus. So here again, this all the vein here, banyak-banyak ni, tak apa-apa banyak-banyak ni, korang nak hafal tak payahlah kan, banyak sangat, too much. So you can, this is your internal cerebral vein, okay, nampak tak? So cerebral vein, and then great cerebral vein, and then straight sinus, pergi belakang. This is your posterior vein. So just follow this one, okay. Okay, now you go through sinus one by one. Okay, you've learned this before. Superior sagittal sinus, yang atas sekali. Okay, it lies in the fixed margin of your falx cerebri. Dah ajar dah itu meninges. Okay, receives primarily from the superior cerebral vein. Tadi ada kan? Okay, so and then it goes from here to the back. Okay, that's number one. Number two is inferior sagittal sinus. Lies in the free border of the falx cerebri. Okay. Sebabkan dia kan free border, dia tak melekat kat mana, di tengah-tengah. Okay. Just and superior to corpus callosum, remember, which communicate between the two cerebral hemisphere. Okay. It drains directly into the straight sinus. Okay. If you look at here, inferior sagittal sinus drain into the straight sinus. This is straight sinus ke belakang. Okay, tak apa. One by one tengok nanti. Straight sinus. It lies in the tentorium cerebelli. This is your cerebellum kat bawah ni. Okay, this is tentorium cerebelli. It lies in the tentorium cerebelli. It drains the inferior sagittal sinus and great cerebral vein. So they drains the inferior sagittal sinus and great cerebral vein. If you remember again, gambar ni, great cerebral vein is here. And then sagittal sinus. Great cerebral vein pergi ke sagittal sinus. Okay. Look at this picture. Superior sagittal turun bawah. Inferior sagittal straight sinus. Kat sini kan adalah great cerebral vein kan, pergi ke straight sinus. Transverse sinus kiri dan kanan. This is your right, this is your left. Okay. And the right transverse sinus, this is your right. It drains directly mainly from the superior sagittal. Nampak tak? Superior sagittal pergi right transverse. Straight sinus pergi left transverse. Okay, and then transverse pula dia akan jadi sigmoid. Which is sigmoid. So from superior sagittal, right transverse, right sigmoid. Nampak tak? Inferior sagittal, straight sinus, left transverse, sigmoid. Okay. And also drains the superior petrosal sinus. So here is a superior petrosal. Also goes to the transverse. Transverse go to transverse. Tak apa, jangan takut. Doktor, benda doktor peningnya tengok. Okay, tak apa, so slow. Okay. So again, so you can see that this is a superior sagittal, inferior sagittal, straight sinus. Ni kan dua transverse. Transverse become sigmoid. Okay. Confluence of sinus kat sini, hujung dia. Here. Tempat pengumpulan. It's a superior sagittal and straight sinus converge at the confluence of sinus. So these two, here is a confluence of sinus. Kat sini and then blood flows to the transverse sinus left and right. I try to find, nanti kita tengok gambar yang lagi cantik lagi. Bukan. Sigmoid sinus is a continuous from the transverse sinus brings to the internal jugular vein. Okay. So sigmoid sinus pergi IJV. Okay. Cavernous sinus receives blood from the middle cerebral vein. Okay, tadi kita belajar tadi, and drains into inferior petrosal sinus. Inferior petrosal sinus pergi IJV. Kalau dia pergi superior, pergi transverse sinus. Nanti awak tengok go through by one. Tak pun jangan takut sangat. I know it's a lot. Tengok sekali lagi, sigmoid sinus masuk IJV. This one is also a good one to go through. Nanti awak tengok satu-satu. Cavernous sinus, superior petrosal, transverse sinus. Inferior petrosal, IJV. So this is your venous system. Again, this is another picture. Sama je. This is transverse sinus, ni superior view and then sigmoid sinus masuk IJV. Transverse sinus, sigmoid sinus, IJV. Boleh nampak Can you follow? Yes or no?
So far so good, Doctor.
Very good. Excellent.
Yes, Doctor.
Very good. So this is your IJV. IJV is here. Internal jugular vein. Draining from the sigmoid sinus. And also draining from the inferior petrosal sinus. And then left through the internal jugular foramen. How was it? Boleh Boleh lah kot Okay, another one I want to show. Groove. If you without the vein, you can see the groove. This is the groove for transverse sinus. Look, this is your where the internal occipital protuberance is where the confluence of sinus is, and you also have, you should also see the groove for the sigmoid sinus. Look, sulcus for sigmoid sinus. Before kat sini ada jugular foramen kat sini. This is where your jugular vein left. It's here. Tak nampak kat sini, tak nampak lah. So this is your foramen magnum. Here is the jugular foramen. Okay. So you can see here is your transverse sinus groove, sigmoid sinus groove, jugular foramen. Boleh Okay. Sikit lagi. So, and things that can happen is central venous thrombosis. Okay. Where there's blood clot in the cerebral venous sinuses and cause problem lah in draining the blood pressure increase and swelling and bleeding of the brain. Macam ni lah thrombosis within the sinus. Here is a picture. Nanti buat tengoklah balik. Okay. Superior cerebral vein drain into superior septal sinus and then pergi ke confluence of sinus. Okay, that's the one. Okay. And then you go another one pula. Superficial. Kita tengok dulu inferior sagittal sinus mana? Tak ada pula sini. Oh, setinggal lah. Nanti saya buat balik. Superficial medial cerebral vein cavernous sinus. And then dia ada pergi superior petrosal and inferior petrosal. Oh, yang ni sebabnya pergi transverse saya betulkan. Sigmoid trigeminal vein. Okay. Deep cerebral vein boleh pergi terus ke straight sinus. Pergi ke confluence of sinus. Satu lagi kita boleh tambah adalah inferior sagittal sinus terus pergi ke straight sinus. Dan nanti saya tambah. Okay. Okay, good. Now, question number 1. Superior sagittal sinus is enclosed by dura mater. True or false? True or false? Terus confused.
True.
True, very good. Inferior sagittal sinus drains directly into the confluence of sinus.
False.
False.
Very good. It drains straight dulu. Yes, so
Inside.
straight first and baru confluence of sinus. Straight sinus runs in the tentorium cerebelli.
True.
Very good. Very good. Right transverse sinus drains directly from superior sagittal sinus.
True.
True.
Very good. Very good. Cavernous sinus drains directly into transverse sinus.
False.
Very good. Very good. Sigmoid sinus is continuous into the internal jugular vein.
True.
True.
Very good.
True.
Superior petrosal sinus drains directly into internal jugular vein.
True.
False. Inferior. Superior tak. Okay, last. Spinal cord. Habis sikit lagi. Boleh ke? Boleh follow lagi?
Boleh, doktor.
Boleh, doktor.
Very good, very good. So, vertebral artery and segmental artery. Dua je. Kita supply to spinal cord. So, ni dah tahu dah tadi. Anterior spinal artery kan? Ada satu. Two posterior. Both are formed vertebral artery. You already know ni. Two posterior and one anterior. And segmental artery kita akan belajar. Anterior segmental artery. Dah tadi kita belajar tadi dah. Anterior spinal artery. Dah tadi. Okay. So it descends in the anterior median fissure of the spinal cord. Kan ada median fissure kan? So dia runs kat tengah. And then it supplies the anterior 2/3 of spinal cord. So awak ni spinal cord. So awak bagi 2, bagi 3. Then this is anterior 2/3 supply by anterior spinal. Posterior spinal posterior 1/3. Dia pelik lah. Sebenarnya sebab satu ni 2. 2 artery supply posterior 1/3 but 1 artery supply anterior 2/3. Okay, that's. You can take this picture to understand. Posterior spinal artery pula tadi yang belakang this one. Tak ada kat sini. Tak ada kat sini, sorry. This is the wrong picture. I'll change this picture. I thought this one is posterior. This is mica. So you know this already. I think I've shown you in the past that there's another artery coming out. Dia akan bagi 2. Okay. Posterior spinal artery. And also it can also comes from pica. So maksudnya it can come directly from the vertebral artery. Also it can come from a branch of this artery. Okay. So it descends on the posterior surface of the spinal cord and supply the posterior 1/3 of the spinal cord. Okay. Segmental artery. Okay, segmental artery, basically what it means, it's coming out outside the vertebral column. Okay, so it comes from the lumbar artery, it comes from the cervical artery, it comes from the intercostal artery. Okay, when it enters, mula-mula dia buat radicular artery. Radicular artery, and then they supply the spinal cord. So segmental means that it comes from as a segment, daripada tepi. Okay, it supply blood supply to the spinal cord at thoracic and lumbar levels. So tu ingat kot, intercostal and lumbar. Okay, segmental artery, nampak tak? So dia masuk as a segment, dia masuk as a radicular artery, and then they can supply. Okay. The biggest one is called the great radicular artery of Adam Kiewig, and this is things that you have to memorize sikit lah. Artery of Adam Kiewig, okay, comes off directly from the aorta. It's an from aorta lah. And then usually varies from T8 to L3. Ni kenapa maybe tak habis ni? Padamlah. Nanti saya cek balik benda masalah ni. Mungkin terpotong masa. Don't worry about this. Not as important. But you have to remember the name of this great radicular artery of Adam Kiewig. Okay, it's coming from aorta. Okay, then veins. Tu je lah artery saya pendek je. You have anterior and posterior spinal artery, and anterior posterior spinal vein, and anterolateral and posterolateral vein. Okay, so here you can see anterior lateral vein. You can see, tengok gambar nanti lah nanti. Okay, and here you can see the posterior spinal vein. You can see anterior spinal vein here. Okay, anterolateral dan sebagainya. Eventually dia akan jadi radicular vein. Sama juga radicular vein. Radicular vein, and then internal vertebral venous sinus, and then external vertebral venous sinus. So you can see here is your external venous plexus, here is internal venous plexus. So from the posterior, from the veins inside, jadi dia jadi radicular vein, and then dia pergi ke internal venous plexus, and then external venous plexus. Itu je. Okay. Spinal cord ischemia. Okay, ini macam ni ischemia lah. Ini ischemia. Okay. So of course, when you have a ischemia, for example, if there is occlusion of the anterior spinal artery, of course it supply the anterior two-third of the spinal cord, and dia akan menyebabkan loss of motor function, because motor is mostly in the anterior, or all are in the anterior segment of the spinal cord. You will learn it on Thursday lah. And also other things like this is sensation problem, weakness of the limb muscle, lost bladder control. So this is kalau ada apa-apa lah. Okay. Last one, ke-10 dah, elok-elok je. Anterior spinal artery arise from vertebral artery.
True.
Posterior spinal artery runs downward in the posterior median sulcus. False. Very good. Sebab apa? As I showed you, dia tak. This one tak. Look, this is the median sulcus. Median sulcus, tapi dia runs posterior. It's not running in the sulcus. Very good. Segmental arteries arise from intercostal arteries.
True.
True. Very good. Very good. True. Okay. Segmental arteries become radicular arteries when enter the vertebral canal.
True.
True.
Great radicular artery arise from the aorta.
True.
True.
Radicular veins directly into the external vertebral venous sinus. False. Internal first. Okay, done. How was it? How was it?
Not
Not bad.
not
Good, doctor.
A lot.
good.
A lot. Good. Very good. Tak apa. Nanti awak go through balik nota saya. Okay, because of course there's a lot of pictures. Sebab saya memang suka buat gambar, so that you can go through only one sentence you go through and tengok balik gambar tu, then it will help you. Okay. Any questions?
No.
No questions, eh? Okay, good. So you can go through back the recording afterwards and go to the notes. I will post it straight away. So any question you can just PM me lah, okay? So anybody want to ask question, you can stay and then ask question afterwards. Okay, thank you so much, guys, and I hope that the lecture was okay and good enough for you to at least have some introduction on the blood supply of the brain of the CNS.
Thank you, Doctor.
You're
Thank you so much.
welcome. You're welcome.
Thank you, Doctor.
Thank you so